It really is a work in progress, and there's a really elegant study published in, I forget if it was Diabetes Care or another journal like that, that looked at that. They looked at the weight loss over 1 year, and they were able to correlate it to the number of clinic visits that the patient had with their doctor. And this is an interesting fact. There are roughly 525,000 minutes in a year. If you see me for 15 minutes, 4 times a year, that's 1 hour. So I'm in your life space 1 hour of 525,000 minutes. So 60 minutes out of 525,000. That's 1/100th of 1%. Now, you've been doing it your way for 50-something years. And in 1/100th of 1% of your life, I'm going to tell you to dramatically change your lifestyle. That doesn't work very well. What they found is that the more frequent the visits are with the doctor, the higher the likelihood that they'll achieve their weight loss goals. And interestingly, we see that in these clinical trials where the placebo arm does about 25 to 30% of that patient population actually gets better if we repeat their liver biopsy. And we think it's because we're seeing them so frequently, like monthly for the study, and we're reinforcing those good habits, even in the placebo group, because that's standard of care, and we're starting to see some beneficial effects from that. If we could kind of get that message across consistently over and over again, it's kind of like going to church on Sunday. You know, we just reinforce the good habits all the time. People are more likely to be successful. Bariatric surgery is an option. There's data that suggests that particularly patients with milder degrees of fibrosis, so stage 1, stage 2, with NASH, do really, really well with gastric bypass surgery. In fact, a lot of them will resolve their disease completely. The more advanced disease patients, the stage 3s and the stage 4s, may get a little better, but the data doesn't suggest that they get dramatically better. So in my practice, we've kind of honed in on bariatric surgery in the select group of patients that have mild to moderate NASH, but have multiple comorbidities like diabetes and hypertension and hyperlipidemia, where the goal there is to resolve a lot of those diseases and as well as NASH. So that's, and if they fail a really aggressive year of diet and exercise, that's the group we think bariatric surgery might be good for. Certainly it's not a cure for obesity in our country, but there are some. Liver transplants for fatty liver disease, they're really a temporizing measure because fatty liver will come back in the new organ. Absolutely. The difference between hepatitis C and fatty liver, though, is this is a chronic disease. It's more like hypertension or diabetes or high cholesterol. So I can't just give you a pill, resolve it, and you're done with it. This is something that's really chronic therapy. The hope is that we can take a NASH patient with fibrosis and we can reverse that, and then we can put them on a maintenance therapy. Or we can reverse it and then they've really worked on the diet and exercise enough to where, hey, they're okay without medicine because they've revised their life enough to where they're not eating the same calories, the same type of calories, they're exercising more, so they don't revert back to the same phenotype that they were beforehand. That's the ideal situation. Reality is probably somewhere in between, and there will be a group of people that will always need therapy, even if you make it better.